I'm not hearing you in the room. Hold on.
Isn't heard me talking.
Hey, Gavin, can you hear us now?
Hey, you're coming through. I hear you good.
We can't hear you, Gavin.
No, it's not a volume issue. Volume's up. Go back to the.
No, we can't hear you.
I can hear you.
You can hear me, but we.
Is this turned down, the TV maybe?
No, you're muted.
I'm muted.
You did.
Yeah.
TV. Yep. That's probably it.
I see one here. Let me go.
All right. I'm sorry. Some quick housekeeping. Who wants to present first?
No, it's gonna be such another meeting. Welcoming.
I'll rework that out.
Hey, can you hear me now?
But do you want to go first?
How are you?
All right. When we do it, I can share your presentation from my computer.
Probably give you
Let
my
drive
page.
if that's
Yeah,
okay.
that'll be perfect. Thank you.
Okay.
Well,
I'll
say next.
Okay.
Yeah.
Great. On the sign-in sheet.
Everyone online, if you would also please drop your name in the chat. We do take attendance of these meetings. We have to deliver a report to the Bureau of Legislative Research next year about our attendance at these meetings, and so it would help us enormously if you would drop your name and organization in the chat for us. Yes, I do. Yes, I am. I got a slide. Okay. All of that was on mute. Thanks everyone for dropping your name in the chat. I can see everyone signing in and I appreciate that. Are we ready to get started?
Yeah.
Okay. I will let you open for us.
All right. Good afternoon, everyone, and welcome to the last meeting of the year for the Health and Economic Outcomes Accountability Oversight Advisory Panel, also known as the ARHOME panel. Glad to have you here a couple of weeks before Christmas. I hope everybody's getting ready for the holidays. I know I am. I do want to let you know that we are preparing to submit our waiver renewal application for public comment. It should go out in the paper on Sunday. And Jennifer will tell you more about the public hearing times that we have scheduled for that and how to submit public comments. But we're very excited to have that coming out very soon. And with that, I think we have a great meeting prepared for you today to talk a little bit about quality measures and to hear from folks across the conferencing on their strategic plans. So I will get us started and let everybody have their Friday afternoon back. Thank you, Jennifer.
For those who might just be joining online, we do have a requirement that we take attendance and record it. So if you haven't already, please go ahead and drop your name and organization in the chat, especially if you are a member or a designee of this panel. We are live streaming this meeting. We're going to have a recording available later if you'd like to watch it again. Today, we're going to talk about the remaining 2024 health quality measure outcomes and our QHP target points and penalties, as well as their strategic plans. This is what Elizabeth mentioned a moment ago. We are holding an ad hoc meeting of this panel on Wednesday of next week at 1 o'clock to allow for public comment on our ARHOME waiver renewal application. We've gotten that set up, and it has been submitted to our notices rather have been submitted to the Democrat Gazette. You'll see those run starting on Sunday. Here's a link to our application and public notices so that you can have a look at those. We've got 2 meetings. The first meeting is going to be held here at DHS and also virtually, and that's December 17th at 1 o'clock. We're holding a second public comment hearing outside of the Little Rock area on Friday, January 2nd at 1 o'clock at St. Bernard's Medical Center in their community room. And there's the address.
And just as a sort of context for what this is, the ARHOME program operates on a 5-year waiver that ends at the end of 26. So to continue the program, we need to get a waiver renewal.
Right, and you may have heard us say that the legislature during session they went ahead and extended in the Arkansas law our authorization to submit another waiver. So it's extended. The program's extended on the state side. We have to submit a renewal application to the federal side. So CMS will be reviewing that. So that's the one that we're looking at. That's the one you'll find posted at the link. If you'd like to attend either meeting virtually, here's the link. It's ar.gov/DHS public hearings, ar.gov/DHS public hearings. Quick reminder, if you're joining us as a member of our panel, we want to encourage you to talk to us, to provide comments. We've got such a great group of people here from a diverse set of disciplines, and we want your feedback. So here's my email address. If you are feeling shy during the meeting, I welcome your emails as well. Okay, so during our last meeting, we covered most of our health quality measure results, but we had a couple of items that we were still having to look at and doing research on. These are the remaining items that we're going to present today. As a reminder, we're talking about 4 things here. Measures, which is the metrics that you'll see. So for example, the percentage of women who received a mammogram. Incentives, those are those lures, the ideas that the QHPs have offered money or other incentives for beneficiaries who will go and receive that mammogram to incentivize going to get your mammogram. And then we have targets. Our QHPs must ensure, for example, 54% of women receive a mammogram. That's the target goal. And you'll see our targets marked on every one of these charts. And then penalties. In our MOU that we have with our QHPs, we have a set of targets and corresponding points and corresponding penalties for not meeting those targets, which we'll discuss more as we get later into the presentation. As a reminder, in 2024, our QHPs were required to offer 2 health improvement incentives for each focus. Those focuses are pregnant women, particularly those with high-risk pregnancies, individuals with mental illness, individuals with substance use disorder, individuals with 2 or more chronic conditions, and individuals living in rural areas. So our QHPs have included activities to support the Health Improvement Initiative in their annual strategic plans, and we'll be hearing from both of our QHP carrier groups today on their strategic plans. Okay, as a reminder, here's what our enrollment looks like. You're looking at the Blue Cross QHPs in blue there, which are Blue Cross Blue Shield, Health Advantage, and Octave. And in green, you've got the Centene QHPs, which are Ambetter, QCA, and Qual Choice. That big tall red set at the very beginning is overall ARHOME enrollment. So this is to provide context, how many people are in each QHP. Okay, moving on to our performance metrics for this meeting, starting with preventative care. As I mentioned, we've got improvement incentives from each of our QHPs for these items. So you'll see here the Blue Cross QHPs in blue. You can see that they've got awards for beneficiaries for each of these four measures. And then you can see in the columns to the side, the number of beneficiaries awarded as a percentage of those eligible and the total amount that was awarded. And here we have our three QHPs with Centene. You can see in the middle the incentive activity, the number of beneficiaries awarded in the next column over as a percentage of those eligible, and then the totals awarded. This is our breast cancer screening measure for those 50 to 64 years of age. You can see the target line is that dotted line there, it's 54%. And on this measure, higher is better. So we're looking at, we have Blue Cross Blue Shield, and we have an octave measure there in the middle, which we'll talk about in a moment, but closer to the target line is better, or above it is having met the target. Octave's new. We have a new QHP from Blue Cross 2024 was their first year of performance. When you see a large kind of outlier, you might be wondering, wow, 100%, what's going on there? Really good performance. And it is good performance. 100% of those involved did participate. But you may be seeing, for example, a lower denominator. If you have, let's say, 100 people in your group and you lose one member, you're still at 99%. But if you have 3 people in your group and you lose one member, you're down to 66%. Sometimes when we see big jumps in our targets or in our achievements here, you might be looking at smaller numbers of denominators. And we'll discuss that at least once more in this presentation.
And that is in fact 3 people.
That is in fact 3 people. But all 3 of them did great, and it was good performance. Here, what we're looking at is the demographic breakdown. So we look at 4 different categories. In the dark blue, we have Black beneficiaries. In the light blue, we have white beneficiaries. In the dark red, we have urban beneficiaries. And in the light red, we have rural beneficiaries. So what you're seeing here is the target line of 54%. And you see Black beneficiaries have met the target because higher is better. But we did see an uptick in all of our demographic areas this year. Moving on to chronic conditions. Again, we look at our incentives. We've got Blue Cross in blue and Centene in green. I'll give you a moment to look at those. Here we're looking at awards for achieving a hemoglobin A1C test result of 7% or less, or for maintaining a ratio of 0.5 or greater for controller to rescue inhaler use for our asthma measure and COPD. This first slide is our QHP performance. Lower is better on this item. So we're looking for bars that are below the dotted line there. Our target is 12.9%, and you can see the individual percentages for each QHP marked on the bars. And here we have our demographic slide. As you can see, that's reflected here as well. We have an uptick. I will point out to you that we've got on this graph, you should look at the left of the screen. We have it kind of zoomed in so that we can better see the differences between each demographic. But this only runs from 10% to 45%. So we are looking at not from 0 to 100, for example. But you can see the differences. We're really close in these areas. 3 of our 4 demographic groups are clustered right there together, and we had an uptick in all groups. We did ask our researchers about this one. Our researchers are telling us that our clinicians say that education and access to care is an issue, and it could cause rates to rise for this measure, but also it's entirely possible that there was some impact from disenrollments. During the public health emergency, we had a freeze on disenrollment, everybody stayed in, and then at the end of the public health emergency, we said, everyone send in your renewal information. Let's find out if you're still eligible for the program. Those who did not send in their renewal information may have been dropped off and then added back, and that can have some impact on the data as well. Okay, moving on to behavioral health care and substance use disorders. Again, we start with our incentives. Okay, here is our QHP performance. This is initiation of substance use disorder treatment, and initiating is one of the measures, and we also have a continuing measure, so you'll see that in a moment. The target here is 44.4%, and higher is better. So as you can see, everybody just about, we got very close. Almost everyone met the target on that item. You can see the individual percentages on the bar, so you can see how close they all were. When looking at it by demographic, you can see that 3 of our demographics are above the target line of 44.4%. Again, higher is better. We are looking again at a zoomed in kind of picture here. We're looking at 30% to 50%. So the gaps between them are a little exaggerated so that we can see better what's going on here. All of our demographic groups have achieved the target. We do have Black beneficiaries below the target, holding almost steady, very slight downtick there, but holding almost steady, and that's about in keeping with the rest of the measures there. We did have an uptick in performance for rural beneficiaries. This is engagement of substance use disorder treatment. Again, higher is better. And you can see we have a couple above the target line of 16.7% there, and several really close. So you're looking at, for example, we're looking at QCA at 16.5%, just below the target of 16.7. You can see those percentages right there on the bars. And here's our demographic slide. We have white beneficiaries and urban beneficiaries clustered right close to the target line, and an increase in uptick in both rural and Black beneficiaries closer to the target, which continues a trend there. This measure is antidepressant medication management, the effective acute phase treatment. This is effective acute phase treatment only. Higher is better for this measure. The target was 60.7%. We've got Octave as an outlier there. It is their first year of operation. That can sometimes, and maybe perhaps a smaller denominator, everybody else kind of clustered together there. This is what it looks like by demographic. We also asked our researchers about this item. The measure steward, NCQA, is planning to retire this measure. NCQA feels it doesn't account for some of the non-pharmacological treatment methods. And as that happens, we may see the adherence rate for this measure go down as new treatments that are not captured by this measure are utilized. So that's some explanation for why we're seeing a downward trend there. This is effective continuation phase of antidepressant medication management. And again, you've got higher is better, and the target is 43.1%. Here's our individual performance. And here is the trend on the demographics. We do have a downtick there, but again, as this measure is retired, this may not be capturing all of the treatments. This is follow-up after emergency department visits for substance abuse. And that's whether they received a follow-up within 30 days of their emergency department visit. Higher is better. The target is 32.9%. We had pretty good performance all around here. Everybody's very close to the target or meeting the target. And that's reflected here in this demographic slide. You can see there's an uptick for all categories, with 3 of our demographics above the target line. Or right at it. For urban, I think is right on the target. This is followed within 30 days of emergency department visit for mental illness. Again, higher is better, and there's our target line. We saw that qual choice is an outlier here. We haven't had a chance to discuss it much yet, but we, as far as our researchers can tell, could have something to do with the denominator versus other QHPs. Still looking into that one. It's an outlier, and they did meet the target. Do you have anything?
I was gonna say, I mean, we do the same for all of our population, so it would just be something related members that actually fell in.
You're hearing Chris Perry from Centene, which is qual choice is one of the Centene groups, talking about that qual choice is the outlier here, but they did meet and exceed their target this year. And here's the demographic slide. You're seeing an uptick in most of our demographic categories, slight downtick in Black beneficiaries there. The rural population almost meeting that target line of 41.7%. So as we discussed, we've got in our memorandum of understanding, we've got target points for the goals and corresponding penalties. We have more than one target. You've been looking at our overall best performance target so far, but we also have a median target and an improvement target. So each QHP has its own target for improving its best performance by 5% for that improvement target. And every target is worth an established number of points. So you might get 2 points for meeting the one of the targets and 1 point for meeting, say, the median target. So a different number of points is set out in our agreement, and that does affect the totals. So what I'm showing you here is a table that compares these various targets. You've got the measure in the first column, and then you've got the target that you were looking at on all of these graphs that we've been showing you, the median for all QHPs, and the 5% improvement target. If no QHPs met it, it's a red block. If most of the QHPs did not meet it, it's orange. If most of the QHPs did meet it, it's yellow. And if all of our QHPs met it, it's green. So you're seeing, for example, in that target, that first column there, you're seeing a lot of red, less red in the median target, and even less in the 5% improvement target. So although someone might not have met their goal overall with the main target, they might have still shown improvement or met the median goal, and they would have been given points for that. You're seeing some not applicable boxes. These are targets for which we did not have a baseline yet. So we can't show 5% improvement yet without an adequate baseline for it. You'll see that as time passes, we'll be able to fill those in. And in the last column, you've got the best performer per category. I am going to kind of move through these quickly. We have other presentations to go on, but this is available online. You can look at it again. And if you have questions or you'd like to discuss any of this, please reach out and email me. I'll give you just a minute on this one too. We're getting into our behavioral category here. A lot more green and yellow. And some of our targets that were real outliers everybody did really well on. And again, check out those best performers on the far side. So here are the results. You've got your Blue Cross QHPs in blue again, and your Centene QHPs in green. The total points come from a point or two for each one of those measures. And for all three of the targets, you've got the overall target, the median target, and the 5% improvement target. And the points correspond to a scale. If you have 50 to 108 points, no penalty, that's the top category. And then it goes down by 9 points per category and the penalty increases. Those penalties are a dollar amount per member per month. So what you're seeing there, let me just take the top row here. Blue Cross at 38 points accrued a $2 member month penalty. They had 925,000 member months, and that multiplied by $2 comes to the total penalty there. I know you see that star by Octave. Octave, of course, we discussed, started in 2024, so they didn't have a 5% improvement target, and we didn't penalize them for that. So instead of having 108 points available to them, they only had 77 points available. So it shows 28 there, but that's out of 77, not out of 108. They have no penalty, but also we don't assess a penalty for the first year of operations. That's part of what's going on there. And I'll give you a moment to look at these. And now we're going to hear from our QHPs about their strategic plans. Give us just a moment to get this set up for you.
Maybe there are any questions.
Yes, if there's any questions, now would be a good time for that. Let's check out the chat here. No questions in the chat yet. Here we are, Caitlin. I'd like to introduce Caitlin Bates from Blue Cross, who will be presenting their strategic plan. You'll need to move from the keyboard. Thank you. Thank you.
Good afternoon, everyone. My name is Caitlin Bates. Thank you for allowing me to present Arkansas Blue Cross and Blue Shield's 2026 ARHOME strategic plan. We're focused. Oh, sure.
Sorry, I gotta make sure that's appear to be sharing.
One moment.
Sorry about that, Caitlin.
That's okay.
Okay. Thanks.
We're focused on enhancing health and opportunity for our members through innovative programs and targeted initiatives. Our strategic vision for 2026 is centered on breaking down barriers for all of our members. At the core, we're focusing on 6 key pillars listed here: a whole person approach through everything that we do, health incentives, behavioral health, maternal health, strategic communication, and improving access for all.
Kim, I think you probably need to mute there.
This vision supports Arkansas Blue Cross and Blue Shield's commitment to advocate, advise, and provide for our members through timely and appropriate care. Ultimately, we're aiming to educate members around the importance of preventive services while offering tailored programs that address our most vulnerable populations. Starting with health incentives, we've seen great success in optimizing our Blue Wellness Rewards program. Incentive modifications that we make every year, combined with enhanced communications, are driving improved member outcomes and greater engagement. I'll point out specifically here that new incentives for chlamydia screening and postpartum contraception, plus the introduction of an at-home STI test kit, help to improve chlamydia screening and contraception postpartum rates from 2023 to 2024, as seen here. This reinforces our vision that by coupling timely rewards with enhanced communications, that can lead to better earnings for our members and improved quality outcomes. We're proposing changes in 2026 based upon this momentum. So next, I will present our changes for 26. We're enhancing our rewards across a lot of them to make them more impactful overall. Starting with adult preventive visit and chlamydia screening, we're increasing those incentive amounts. And then for cervical cancer screening, prenatal care, and postpartum contraception, we're enhancing some of the service offerings within the description. Specifically, we're increasing awareness about the at-home test kit for cervical cancer screening. And we've changed the name of postpartum contraception to family planning after birth. We find that that is more accepted, and we are pointing members to different care options for accessibility, such as pharmacies, and the development of a pharmacy search tool that they have there within the rewards program itself. Next, other 2026 changes. We are promoting more timely follow-up with our alcohol and substance use treatment and follow-up action. This year, we are rewarding for 2 follow-ups. We're going to do that after 1 for next year for more timely rewards. And then the last 4 here are new incentives. Our follow-up after hospitalization or ED visit for mental health, that one is mirrored off of our substance use disorder incentive. That performs very well. So we are doing that for mental health as well. Asthma medication use, we're going to use that one instead of heart failure visit and follow-up. Pharmacy claims allow more timely rewarding, so this will help improve asthma and respiratory conditions for members that are overusing rescue inhalers. And then our last 2 incentives here are targeted towards our rural members. We are incentivizing for telehealth access for those members that have a far distance to travel to see their PCP as an in-between option. And then finally, we are incentivizing for long-acting injectable use for antipsychotic medication adherence. we find that we see a lot better improved adherence, and members stay on the treatment better when using those tolerated antipsychotic equivalents. Moving to strategic member communications, our strategy targets population with the highest opportunity for quality improvement, and we consider timelines for short and long-term goals. Within our short-term goals, we are focusing next year on a maternal health journey for women of childbearing age, reducing ED visits overall, enhanced incentive communications across the board, and promoting pathway to prosperity once more information becomes available. Our long-term focuses will include custom journeys for members with chronic conditions, along with medication adherence, pharmacy clinical services, and a focus on rural members and SDOH to break down barriers. This ensures that all of our efforts really support our larger mission. We engage members through multiple channels, as you'll see here, for a personalized experience that enhances their care. Communications are adapted to the member's journey where they are based upon different channels, and they can elect into certain channels and based upon preferences, and also claims-based outreach to meet them where they are at that moment and inform them about what they are needing to improve upon health. We offer a lot of digital communication options, emails, texts. We have a welcome guide called a quick start guide for our new enrollees, as well as mailed communications. These create continuous engagement, making interactions relevant and action-oriented. Enhanced communications are yielding results similar to our incentives. Specifically here, I'll call out that increased communications about prenatal care resulted in a higher prenatal incentive payout. That's the graph on the right you see there. This is for our Health Advantage plan. This might have contributed to dramatic improvements in our Health Advantage birth outcomes compared to previous years in 2024. Our communications deliver continuous engagement, and we tailor improvements each year based upon focused populations. Due to quality improvement opportunities overall and what we observe in the data, Arkansas Blue Cross is focusing on improving our communications for these 5 populations here. These include women of childbearing age, members with mental health and substance use disorder, members with multiple chronic conditions, opioid users, and members that skip PCP visits but frequently visit the emergency room and hospital, and aiming to point them to providers. This targeted approach helps us meet unique needs and drive better health. We're using conversational two-way text messaging to generate inbound calls to a wellness navigator team at Arkansas Blue Cross, connecting members for breast cancer, chlamydia, and cervical cancer screenings so that they can complete a screening with a provider. Before starting this outreach, we reached less than 10% overall of non-compliant members. That's attempts, with an overall 8.7% engagement. But after the two-way text messaging was initiated, we can now reach almost all of them due to high volume outreach. And this does increase our engagement by an addition of 10.4 percentage points. So overall, we are having a lot more engagement. And through that engagement, we're driving a lot of transferred calls to our team. About 19% of those engaged are transferred, with 14% being long calls greater than 2 minutes. This is 7 times the amount of members that we're able to reach now, and we're driving better action. Two-way text messaging has a conversational, informative tone. It's boosting engagement in women's health screening rates. You'll see here the gap closure rate. It increased from 22.8 to 24.8 using this technology. And based upon the volume that we're able to reach, we have 6.7 times the amount of members closing their women's health screening gaps. This demonstrates the power of this solution's scaling outreach effectiveness. Our whole person approach points members to providers while addressing physical, behavioral, and social needs for better outcomes and lower costs. Blueprint Primary Care in 2025 is serving 71 counties across Arkansas, with just over 40,000 members attributed to the counties and clinics that are a part of this program. We make it work by meeting members where they are, using pharmacies, telehealth, and community sites to extend beyond the provider and in between care episodes. We're embedding care management for chronic conditions, behavioral health, and social support, and we're rewarding providers for quality and proactive preventive care. This integrates care in a comprehensive way. Sure.
Did I understand that earlier you're retiring as an incentive to establish a PCP?
We are, yes.
And so I'm guessing that decision was made in combination with what you're doing with PCPs here.
We-
Maybe.
Sure. I mean, I think really overall it was that we didn't have a lot of engagement. It was 2 visits that the member had to attend to get that reward. So overall across the board, we're going to a quicker way in which we're incentivizing for that progress towards goal. So it really didn't have anything to do with this,
Okay.
not necessarily.
Yeah.
But good point. Kind of correlates. In Blueprint Primary Care, our members receive better quality care overall with higher rates of preventive screenings and better chronic condition control across most metrics as seen here. This shows the impact that Blueprint Primary Care makes upon preventive and chronic care. We collaborate with pharmacies to help members control diabetes and other chronic conditions, enabling positive journeys for our members with pharmacists and improving their outcomes overall. We measured the impact of the diabetes chronic care management, and we found that the treatment group had 23% less likelihood overall of inpatient stay. We really value our partnership with pharmacies and providers for better disease management and reduced acute care. In 2026, to better understand our members' needs, we are going to employ a pilot program where we'll engage with 500 hard-to-reach members with chronic conditions and social risk factors to promote daily adherence. We're going to focus on using daily engagement, rewarding a small amount every day for behavioral change. And this looks like the example presented here. They might take a picture of their glucometer to show their blood sugar each day and they'll get $2 that day, or take a picture of the medication that they'll take and it will validate it according to what the medication is and reward for that. So we will measure the reduction in ED visits and hospitalizations and hopefully get some engagement with members that we wouldn't otherwise be able to reach.
Is this the first time you're using that?
Mhm,
Yeah.
yes.
Okay.
We haven't started yet, but I'm excited too. Our 2026 maternal health strategy is built around one core idea. We're meeting high-risk moms where they are with the right support at the right time. We target all women of childbearing age with intensified focus on those pregnant and postpartum members that we know about through claims. We're using our special delivery, high-risk pregnancy case management program. And new for 26, we're going to have a more intense focus on SDOH needs, where we'll actually provide resources and care packages with food, supplies, and diapers, et cetera, delivered to their door to motivate moms to take healthy actions during pregnancy. We have planned for strong incentives, enhanced communications too, as well as promoting Maternal Life 360 to all of the pregnant moms, and then proactive contraception counseling to support planned healthier pregnancies, all while monitoring for comorbid chronic conditions for better care. Here's a look into that SDOH focus. We will offer a personalized journey that includes box deliveries through checkpoints for doing healthy recommended actions, such as attending a prenatal visit. We'll be providing food and essentials, and we'll be customizing based upon the needs that we learn about through SDOH surveys. We're also using health literacy tools, human and digital coaching and education throughout the program, and constant feedback loop through continuous surveys to continue to improve and meet that member's needs. This is also a change in what we used to do for maternal health, and so I'm excited to see the impact of this as well. This is our maternal health journey with messaging included about some of the things I've mentioned: prenatal visits, chronic condition management, special delivery program, our SDOH program, and postpartum care. which includes the mention of family planning. We turned 187 community pharmacies this year into access points for contraception counseling and medication. We have 2 active programs today. Program 1 including 72 pharmacies and Program 2 including 115. You can see the footprint across our state and most of our counties. Early results are very interesting. We're learning that 52% of members are reporting that they already have a method of birth control that is not seen in our claims. So it could potentially be through a different health plan, or and again, I don't know, we're looking into that data. So I'm excited to learn more, and we hope to be able to submit this to Optum this year to show, proof from a different plan through supplemental data. But we do believe that our contraception rates might be higher than what is actually reflected. And the bottom line here is that pharmacists are a trusted, convenient on-ramp. They're able to reach our members. They have great relationships, and they can reach more of them than we could ever try to by telephonic outreach. So we are really valuing our partnership with pharmacies and providers. We're elevating behavioral health as an essential part of total wellness by focusing here. We help members accept and engage in care to prevent crises and manage conditions effectively. We do this by offering our 24/7 behavioral health case management, around the clock, personalized multi-channel communications, flexible treatment options in the form of virtual care to eliminate barriers, and peer support specialists out in the community covering the state of Arkansas as an extension of our providers. This integrated framework isn't siloed, and it works in combination with all the other initiatives I've mentioned. We know timely rewards and education prevent crises. There are initiatives offered for mental health medication adherence and follow-up after hospitalization for substance use. We can see the results here. Our redemption really increased by 54% relative improvement. And so through that, we were able to see a reflection in quality performance. You'll see that our FUH performance there in the yellow improved dramatically. And we think that that's in part due to incentives and also improved case management engagement, as we saw a significant improvement with our Health Advantage plan by 20.7%.
That was one of the things I was going to ask about, because it does seem like there is more of a direct link between the incentive and the outcome than maybe in some other measures. I just didn't know what you guys thought about, but you changed one of your incentives to a follow-up measure, right?
I did.
Yeah.
Because of this success, we're going to do it across more conditions for next year. Yeah. Thank you for noticing. Throughout our partnership with Legal Aid of Arkansas that offers free civil legal aid for members in substance use disorder recovery, we were able to observe some powerful results. This is a little outdated. I believe we have 16 cases now with results, but based upon the 13 when this was created, we saw that the Beyond Opioids program removed life-altering barriers for our members, including 4 family law, 2 criminal expungements, 2 housing, and 2 employment or economic cases. So this pilot really demonstrates that stable housing and employment leads to sustained recovery, and we hope to contribute to that. Even small legal fixes are able to yield some big health wins. We're tackling access barriers heads on with innovative programs and no hassle screening options that bring care directly to members' doorsteps. Breeze on through those pictures. We're removing transportation and stigma barriers with free mailed screening kits also. Our members really like the kits. We had some members that have never received a cervical cancer screening before, and they were more willing to do that if it was delivered to their door. So with a 15.4% engagement with cervical cancer screenings, we would like to continue to do that through 2026 and see hopefully a bigger impact going forward. We offer A1C testing kits, chlamydia screening testing kits, and cervical cancer screening testing kits. This shows our pharmacy clinical services search tool. Just like our provider search tool, you can now search by zip code to find a pharmacy providing clinical services near you. And this will show members pharmacies that can provide naloxone prescribing, HIV testing and treatment, contraception prescribing, immunizations, flu and strep testing and treatment, and more, to help point members to that accessible care option. Health and financial stability go hand in hand. We're offering new 2026 incentives to drive self-sufficiency and also in preparation for Pathway to Prosperity. We are going to offer $5 for some contact information to be provided, $10 for registering for launch and searching for jobs, and $100 for completion of a recommended training on the launch portal to progress towards an improved career or changing career, better economic situation. With that, everything you've heard today builds upon our proven wins in 2025 and our health opportunities that we see, ways that we can improve. We believe these initiatives can move the needle through all of our strategic pillars, and we're committed to partnering with DHS, providers, pharmacies, and community-based organizations to keep pushing through hard boundaries and challenges with open minds and relentless innovation to make Arkansas healthier, one member at a time. Thank you for your partnership.
Yeah.
Any questions?
Put the clap.
Anyone online have any questions?
I do. On the incentives, are wearables, are you incorporating wearable technology in any incentives yet, like the micro incentives?
So with our, excuse me, suddenly I need to take a drink, excuse me. We are not with our regular incentive program, but I'd like to test it out with our daily 500 member pilot that we're doing to see how that goes and maybe scale it for the future. Okay, I'm turning it over to Chris Perry for something.
All right, good afternoon, everybody. I'm Chris Perry with Centene, so I'll be presenting our 26 strategic plan to you. Our program goals here are improve the health outcomes of ARHOME participants, providing incentives for mental health, infant health, rural health, behavioral health, and chronic diseases. We also want to move our members out of poverty and up the economic ladder towards independence, so we have incentives for that. We have 3 new incentives or 3 focus areas for 26 that we're adding to our plans, and then we'll talk about the ones that we're continuing. But breast cancer screenings, diabetes, and behavioral health are the 3 target areas for 2026. Our 2026 continuing plans will continue with our My Health Pays member incentives. We've probably talked about this before, but that's our platform that we use to incentivize members. They can earn up to 5,000 points, which equates to about $500 in money that they can spend on copays, deductibles, utilities, telecommunications, rent, education, things like that. So very wide range of things. Here's just kind of an example of the dollar amount that they will earn for the different areas. I'll point you to the annual wellness visit every year, $50. The biggest one is $250 to complete the annual risk assessment. That launches at the beginning of every year. And so that's just asking questions and trying to find, do they need care for chronic conditions or some other type of condition that we can help them with. So that's important for them to continue or to do each year. We also have challenges and power-ups, which are challenges or those items that they can kind of do maybe on a journey to improve their finances or track their spending, budgeting, things like that. Power-ups are quicker. They can watch short videos that will help them with the same type of activities, reducing debt, being kind to yourself, things like that. Our maternal health, we launched this, I believe, in 2024, Farm Box RX, and that's where once members notify us they're pregnant or we get through claims that they have seen a OBGYN for that. They can receive up to 6 healthy food deliveries, fruits, vegetables, pantry staples, and that can be customized. They can choose later on what type of box they want. And then in those boxes, we can customize communications, giving them information on doing their glucose screenings, ultrasound, participation in case management, and then our Smart Start for Your Baby as our maternal program. They will also get different things with that along the way to help them prepare for babies. We have a couple of different provider incentives that we do. Continuity of care program. This is a continuation from 25. Providers are incentivized for engaging with the members, getting them in, addressing their chronic conditions, and closing quality gaps. In-office assessment, basically the same thing. It's just some providers continue to work, and that's through an Optum program on the in-office assessment. So it's the same premise. The continuity of care program is our in-house program. And we'll go through the continuance of the existing programs. We've continued to partnership with the Workforce Development Board and having fairs with them when they're present and trying to get members to partner for those events. Smart Start for Your Baby is a specialized case management program for pregnant moms, trying to incentivize or reduce the low birth weight and preterm births. That's case management, care coordination, disease management, and health education. Community mental health events. We offer educational sessions and health and safety opportunities to assist women as they prepare for their upcoming delivery. And that we have mental health experts on site for those. Our HALO program, multimodal evidence-based program that supports members at risk for substance misuse and substance use disorder, providing interventions across the prevention through recovery. In-home assessments, those are for members that aren't able or can't transport themselves to a physician. We have a clinician go in the home and conduct those so that we can address what open gaps in care they have and make sure that they're getting the care that they need. Our pharmacy lock-in program is basically to detect and prevent abuse in the substance use and opioids. Members are meeting criteria locked into one pharmacy, and then they can't go to others within that year. Find Help is our SDOH platform that connects members to social care needs, groceries, childcare, transportation, housing, legal aid, things like that. And we are also added an SDOH screener with member outreach by Pix Health. I think we'll talk about that here in a minute as well.
On those in-home assessments, do you contract out?
Yes, it's
Like Spencer?
I don't know that name.
Okay.
Do you know the name? I can't remember.
No, it's a corporate contract that we use, and so they assess the vendors annually and use the appropriate ones for the market. But they do also bring in in-home test kits and other educational tools to help close those gaps. So not necessarily Sprinter, but it's the same concept.
Yeah. I talked to a Sprinter person and they at a conference and they
Okay.
were like, we don't even talk to them.
Signify is one of them. I can't remember the other name. Yeah.
That are available,
Yeah.
so.
We use 2 or 3
That's
because
one of the
sometimes they don't have
Yeah.
people in certain areas of the state, so we do have 2 or 3. Community health and resource fairs. We host these. Members can speak to healthcare professionals, health insurance experts, community service providers. Our Ambetter mobile app that launched, I believe, last year they can keep track of their My Health Pays information, anything claims-based items that they need there. Harmony Cares, those are in-home test kits. Angel probably knows more about this than anybody, but we send these test kits out for screening for schizophrenia, bipolar, antipsychotic medications, chlamydia, and various other things.
All the same ones that Blue Cross mentioned
Yeah.
earlier, we can find things like that.
We've partnered with several mobile mammography units, UAMS, Baxter Health, and St. Bernard's to get into the communities where those members are not able to get into provider easily. Our METS program is a recovery-centered approach for high-risk individuals with significant mental health needs and outpatient behavioral health utilization. So those are case managers that help identify and get those resources where they need on those. Choose Tomorrow is our suicide prevention program that we use. PICS Health, I mentioned this earlier, as a social health platform that pairs peer support and empathetic technology to address loneliness. That's one of the biggest reasons we see members accessing ER, things like that. They're just lonely. And so this has been a big help to get members. They just want to talk to somebody sometimes, and it helps before they access care that they really may not need. Sober Sidekick, this is an app that we've partnered with for a couple of years now to help members maintain sobriety, connects them with a community of people that are in the same journey in life, and they can predict 93% accuracy that they're going to relapse here. And so that's been a very good partnership. We are developing member incentives and additional engagement opportunities with them for 26 and trying to get that utilization increased. Our well-framed digital case management, concierge-like medical case management, that's been a big uptake for members because they can do it right here in their home without needing to see a doctor. Our new program implementations we mentioned at the beginning for 2026, looking at a mammography facility incentive program so that those facilities can get an incentive by actually outreaching to the members that we send them listings on so they can get them in so they can close that breast cancer screening measure. Our value-based care program with NeuroFlow, which is a behavioral health pay-for-performance program, rewards providers for meeting and exceeding predetermined metrics focused on clinical outcomes, patient engagement, and care coordination. This targeting members will include those with moderate to high BH severity who are unengaged with services 90 days prior to ER visit. Modify Health, eligible and better members with no-cost 12-week medical tailored program, meal program that offers healthy meals and telephonic dietitian coaching for members that have an outer range A1C, and so that we can get those members measures up for the A1C values. Lower those. All right, any questions?
I just shouted mine out.
That's all right.
Thank you.
Okay, when I got a clip.
Thank you.
Thanks to both of our presenters. Hey. There we are. Okay, closing out. A reminder that our waiver renewal is going out for public comment next week. You will see in your email, keep an eye out. I'm sending out an invitation for the December 17th meeting. You're welcome to also attend the meeting that will be held in Jonesboro in person or virtually at the link that we showed earlier. You can look for this presentation to be posted on the DHS website after the meeting as well. Our next meeting is in March. We'll get you the date and location as soon as we have one established. And our meeting topics for March are going to be the ARHOME evaluation and survey results and a maternal life 360 update.
Just learning.
Before we close, are there any other questions? Not seeing any in our chat. Thanks so much, everyone, for joining us. If you have any questions, please reach out.
Thank you, everyone. Thank you.